There is an association, a new association called Care Medical Professional Association. This is an association which has come up. It's actually formed with three core things. Its main aim is to serve, to provide service, to educate, and to empower the general public. In terms of service, Care Medical Professional Association is known for actually engaging in such activities which you've mentioned, like provision of free medical camps to the vulnerable communities outside there. Apart from that, it also offers mentorship programs. It also does health talks. So Care Medical Professional Association is basically an association which encapsulates all medical professionals who are coming under one roof to just give back to the community through their various strengths. So speaking of partnership, would KPA look forward towards working with such associations who are doing noble activities outside here for the general betterment of the community?
Yeah, definitely. We say your network is your network. Yes. We are an association that networks a lot. Looking from this even this conference, we are here with several partners. Correct. Looking at our visitors book, we have partners who have visited our booth from different organizations, from different countries, trying to know who KPA is, what we do, what can we contribute in terms of what they are also doing. And I think from the conversation we've had from you earlier before this interview, there are a lot of areas that we can collaborate. I'll give an example. You've talked about mentorship. This is something that is very strong within the KPA structure. Across the branches, we have institutions offering pharmacy. Across branches, we have 11 branches in the country, each branch covering a number of counties. Yeah. So within those jurisdictions, we have institutions offering pharmacy. We collaborate a lot with those institutions to ensure that we mentor those pharmacy students to become professionals that are ethical and are responsible in practice when they graduate. You have also talked about areas of giving back to society. Yeah, I've also mentioned that we do medical camps. Correct. We do, according to the WHO calendar, we organize events that commemorate such events. I've talked about Diabetes Day, World Hypertension Day. I think this month we are talking about World Pharmacist Day. Correct. We are having events across the branches where we commemorate and create awareness to the public, yeah, to ensure that they know the contribution pharmaceutical technologies play in the country, as well as they know how these conditions affect them directly or indirectly. So definitely, from your question, to answer directly, there are many areas of collaboration. We just need to align our efforts and make sure that our efforts are aligned towards the goals and objectives of each organizations we are working with. And definitely we can work with such organizations either nationally or internationally, and we are able to grow KPA in terms of stature, in terms of contribution in the healthcare delivery in Kenya. And maybe just to mention a few areas that we are working on. We have organizations that we are partnering in the area of family planning. Yeah, family planning, where our members, in terms of capacity building, we are able to capacity build our members and their facilities to be able to offer comprehensive family planning services. I'm talking about short-term methods. I'm talking about creating safe spaces, especially within our facilities, so that members of public are able to access FP services from our members. And this partnership spans even to the MOH. We're partnering with PSK, we're partnering with global funders to ensure that we capacity build and enable our members to be able to contribute even in that area. There are many areas of our practice that we collaborate with many other partners. I'll give an example. Another example. KPA, through collaboration with a partner called In Supply Health, yeah, contracted a firm called Kenya Factors that wanted to assess the capacity of KPA and know where gaps exist, where our weaknesses are, our strengths are, our opportunities, and such. Yeah. belong. And there is a report called OCA report. It's called Organization Capacity Assessment Report. In this report, it highlights some of the areas that need improvement. Such areas like do we have a strategic plan as KPA that spans like what do we want to achieve in the next 5-10 years? Yeah, we are at that level where we want to implement the strategic plan, and we have our KPA constitution that says we can have a secretariat, so that me as the president, I don't need to travel from the coast to come and do some administrative work that needs to be done by the secretariat here.
Correct.
Yeah. So for us to be able to implement the OCA report, to implement the KPA constitution fully, it means that resources is a very central determinant in this matrix. Yeah. So for us also to develop KPA to a level where we can also look for resources. Yeah, like we can apply for funds from people who fund such activities. That capacity needs to be there. So we have different areas that the partner is supporting KPA to be able to strengthen its structure so that we are able to reach that level. We are still progressively but steadily moving towards that direction. It's all because of partnerships.
Wow, guys, anytime you're having a conversation with the president of whatever institutions, they are always comprehensive, detailed, and of course, informative. From what we've heard today, of course, you've learned a lot. Guys, we want to transform into, there's a new organization in town, so which I would want Robert to actually give us a brief about it. So it's called Kenya Medical Professionals Association. So Robert, in a nutshell, can you explain to members what is Kenya Medical Professionals and what does it entail, and what are its benefits to members outside here, both who have joined and those who are actually envisioning to join it? Robert?
Yes, thank you once more, Dennis, for this. I want to talk about Kenya Medical Professional Association. Actually, this is a group of all medics, registered medics, enrolled medics in Kenya. We have come together solely to conduct effective medical camps to rural and underprivileged urban centers. So this is a home. This is a home for every medical practitioner who would like to give back to the community. At times, you can reach to your level of self-actualization in your professional, and the most important thing to the medical practitioner is normally to give back to the society. So this is a very essential association that I would like each and every medical practitioner to join us too. It's not only for the medical practitioner, but also to the students who are undertaking medical courses in Kenya. Any medical related courses in Kenya. It's very simple. How do I join Kenya Medical Professional Association? So there's a number at the back of at the front of the screen. You just SMS the number, join. You just SMS the name, join to that number. So immediately you SMS the name, we shall get in contact with you. The registration is 500 shillings, and after that we shall tell you more about the details that you might need for you to join our association. Kenya Medical Professional Association is an association for all, and maybe Dennis, if you want more elaboration of what we are doing or what we have been doing, I can still elaborate.
Thank you, Robert. I think that's basically the backbone of it. But just to add a few on Kenya Medical Professional Association, apart from offering effective medical camps to the underprivileged, we also empower. We do empowerment programs. We also do mentorship programs. So what that entails, it means that we will be working towards various institutions, getting members who actually needs to be motivated and needs to be mentored through various avenues, and we provide that program because we are a pool of different cadres who are of medical professionals here, and not only are we onboarding medical professionals, by the way, if you are someone outside there, if you are somebody whose heart is with the public, is in giving, we welcome you to come join us, partner with us, so that we can actually bridge the gap of actually helping the needy in the community. If you do that, we will actually be happy. So we are calling upon all sponsors, all like-minded people to join us in this drive as we strive to actually offer effective services to the general community. We are all volunteers, and as we also volunteer, we want to ensure that we touch lives outside there. So guys, I think that marks the end of this expo, but as we end it, I would like our guest today, Ruth, to close for us the show. Let her give us her parting shot on the show.
Thank you, Dennis. Thank you, Robert. It's really a pleasure. I think to people out there, the call has been made. Please honor it. I think it's always good to give back to the community, and the community today would be even people in our rural homes who have no access to what we are privileged to have on our day to day. So please honor the call and welcome to CARE. Thank you.
Thank you so much to our cameraman, Mr. Victor Igwe. It was so nice linking up with you all the way from Nigeria.
Shout out!
Shout out.
Hi.
Thank you, Victor. We appreciate. Thank you, Victor. So guys, that's how we end it. Always keep it the Gatekeepers TV, your number one informative channel. Until next time.
Weather.